Well, if you live in the Central Valley, chances are you know about or have had valley fever. The CDC estimates that there are between 10 and 20,000 new cases of valley fever reported every year. But that number seems to be growing, and doctors are now encountering cases in regions not traditionally affected by valley fever. And that's why this month, the CDC, in conjunction with infectious disease experts from Community Health System and UCSF Fresno, are closely monitoring the changes and taking steps to help combat the problem. Dr. Geetha Sivasubramanian is a leading national expert in infectious diseases. When NBC News reported on more than a dozen people contracting valley fever while attending a music festival in Kern County, they turned to her expertise and experience.
So valley fever is an infection. It's caused by a fungus. This is a fungus that is in the form of spores, lives in the soil around us. So you inhale the fungus from the soil and it gets into your lungs. In general, this fungus is called a shape-shifting fungus because in the soil it has a different form and in the body it has a different form. So in general, these are like shape-shifting fungi.
Valley fever is not new to the Central Valley, from which its name comes, nor to parts of Arizona. What is new are the number of cases being reported and the spread of valley fever to places that don't typically see it.
We are seeing more cases. The number of cases being diagnosed are definitely going up. And that could be a multitude of factors. It could be that we are testing more, but definitely we see every year the number of cases going up.
60% of people who get valley fever might not ever even know they had it. It's the other 40% that doctors are concerned about. Their symptoms are more compelling and can easily be misdiagnosed.
The most common misdiagnosis with valley fever is just bacterial pneumonia. So they often get diagnosed as pneumonia and get treated with antibiotics, and they don't get better despite the antibiotics. So if you have a persistent cough that's not going away, you got to think, okay, this is probably not a bacterial pneumonia or a cold.
Equally important to track is the spread of valley fever. While it does not transmit person to person, cases are now being reported in Utah, Wyoming, and even into Canada. There are several possible reasons for the spread, and while researchers study those factors, people like Dr. Sivasubramanian are looking to practical steps that can be taken now.
If you work with dry soil and you dig with dry soil, it's important that you wet the soil first before you start digging. So you can reduce the risk of the dispersion of the spores pretty significantly with that. We need more point of care testing. We want something that's quick to diagnose. Just making sure you wet the soil, wear your mask. If you're having recurrent cough, make sure you go to a doctor. People need to think about it. Doctors need to think about it. Employers need to think about it so that they can counsel their workers and give them the appropriate measures they need to protect themselves.